My name is Angela, and I'm a family nurse practitioner student at the University of Memphis, and I will be performing your head-to-toe assessment today. Throughout the assessment, I will be looking at your skin, noting color, texture, signs of scars or masses, any nevi or lesions that are noted. So to start off, we're going to look at your head is midline, so I'm going to inspect your hair, noting the color, the distribution, inspecting your skin for any lesions, signs of infestations, or okay, so everything is normal there. So now I'm going to palpate your temporal arteries. Any pain or tenderness there?
No.
Okay. Frontal and maxillary sinuses, any pain or tenderness there?
No.
Okay. Your trachea is midline. So now we're going to move on to your lymph nodes: preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Your nose is midline. I don't notice any drainage or crustaceans coming out of your nose. So if you would just block one nostril, breathe in, okay, and then do the other side. Nasal patency is normal. So while we are here, I'm going to go ahead and assess your range of motion of your neck. So your head is at extension, so if you will flex your chin to your chest, bring it back to extension. I want you to hyperextend by looking up at the ceiling. All right, bring it back to extension. Lateral rotation by lateral flexion by bringing your chin to your shoulder, and then lateral rotation by bringing your ear to your shoulder. Good. Okay. So now we're going to move on to the cranial nerves. Cranial nerve 2, I'm going to test your visual acuity. So if you will just read this first, stretch this out and read the first line with both your eyes.
EJKSOP.
All right, and then cover one eye and read the second line.
BLNFAC.
All right, and cover the other eye.
FRSLMU.
Okay, good. Cranial nerve 3, 4, and 6. I will be looking at your pupils. I will be testing direct and consensual pupillary response. So just look straight ahead. I'm going to shine a light in your pupils. Okay, pupils equal reactive to light, and then I'm going to bring this in, and I want you to just follow it with your nose. And accommodation. Good. So now we are going to check your 6 cardinal fields of gaze. So I want you to just take your eyes, keep your head still, and follow my finger with only your eyes. Good. Okay, and so now I'm going to also check your red reflex. So I'm going to just look straight ahead, and I'm going to come in and look at your eyes. Okay, red reflex is present. Sclera and conjunctiva are of normal color. No drainage or lesions noted. Eyelashes are not crusty, and there's no patches missing, and palpable fissures are normal. So cranial nerve 5, I'm going to check your masseter muscle. Any tenderness noted?
No.
Okay. And so while your eyes are closed, I'm going to take this cotton wisp and I'm going to touch it to your face in various places, and just say now when you feel it. So close your eyes.
No. 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 No.
Good. Okay, so cranial nerve 7, we're going to test your facial expressions. So smile for me. Okay. Puff out your cheeks. Okay, purse your lips and raise your eyebrows. Good. So cranial nerve 8, we're going to test your hearing. So the first thing that we're going to do is I'm going to have you cover your right ear, and I'm going to whisper 2 words, and you tell me what you hear.
Apple, banana.
Okay, we're going to do the same style on the other side.
Ball, bat.
Okay. So now we're going to do the Weber test. I'm going to place this on top of your head, and I want you to tell me if you can hear this evenly in both ears.
Yes.
Okay. And now we're going to do the Renee test. I'm going to put this on your on the back of your ear. I want you to tell me when you can no longer hear it.
No.
And can you still hear it?
Yes.
Okay. We're going to do the same thing on the other side.
No. Yes.
Okay. Air conduction is greater than bone conduction. So now I'm going to look in your ear at your tympanic membrane. Tympanic membrane is visible, pearly, gray, translucent, and all bony structures are visible. Same with this ear. So cranial nerve 9, 10, and 12. I'm going to look in your mouth, have you stick out your tongue and say ah. Uvula is midline, rises evenly. Tonsils are normal, so can you rise your tongue up? Oral mucosa is moist with no lesions. Teeth are intact with no loose or missing teeth or signs of dental caries. So the last cranial muscle is cranial nerve is cranial nerve 11. I want you to shrug your shoulders against my resistance. Good. Okay. So now we are going to look at your breathing. So I'm just going to watch you breathe for a second. So just breathe normally. Anterior and posterior lung fields are normal. No accessory muscle use. No signs of tachypnea or cyanosis noted. So I'm going to place my hands on your back here. Every time I place my hands, I want you to say 99. I'm testing for tactile fremitus.
99. 99. 99.
Okay. And I'm going to go ahead and also palpate your thyroids and some back here. So if you'll just swallow for me. Thyroid rises normally. I'm going to percuss on your lung field, so you're going to feel me tap on your back in various places, okay? Okay, and while I'm back here, I'm also going to go ahead and we're going to do some various listening exercises. So when you feel me place my stethoscope this time, I just want you to take a deep breath in and out. Okay, and so this time we're going to test for egophony. So when you feel me place my stethoscope, I want you to say the letter E.
E. E. E. E. E. E.
Okay, we're going to go through those same spaces again, except this time we're going to test for bronchophony, and I want you to say 99.
99. 99. 99. 99. 99. 99.
Okay. And also while I'm back here, I'm going to go ahead and test for your costovertebral angle tenderness. I'm going to place my hand and you're going to feel a thump. Okay. And we're going to do the tactile fremitus on the front as well. So again, when I place my hands, I want you to say 99.
99. 99. 99.
Okay. And I am going to listen to you. So the same as the back, when you feel my stethoscope, I want you to take a deep breath. Okay. So now we're going to move on to the cardiac cycle. So I'm going to palpate your carotid arteries. So I want you to just turn your head this way a little bit. This way. Carotid artery pulsations are normal. So now I'm going to listen with the bell of my stethoscope. So we're going to turn your head, and then I'm going to need you to hold your breath. Okay, so turn towards me. Hold your breath. I'm checking for bruits. All right, catch your breath, and we'll turn that way. Okay, no bruits noted. And so now when I place my stethoscope, I want you to just breathe normally. I'm going to listen to your heart tones. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, so if you will just lay down for me. So before we move any further, we're going to act as though this bed has 45-degree angle, and I'm going to check for jugular vein distension. So turn your head this way. I'm not noting any jugular vein distension this way. We're going to turn it this way. There's no distension or pulsations noted this way. So now I'm going to listen to those same points of your heart except with the bell of my stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, so if you could just turn to your left for me, I'm going to locate the point of maximum impulse. Point of maximum impulse is located at the 5th intercostal space. Go ahead and turn on your back for me. Usually I would listen to that for a full minute, but for time constraints, we'll just say we did. So now I'm going to listen to your abdominal arteries for any breweries. We have the aorta, renal, iliac, and femoral. No breweries noted. So while you're laying here, I'm going to inspect your abdomen for contour. Contour is rounded, non-distended. I'm not noting any obvious masses or scars. So now that I've inspected, I'm going to listen to your stomach. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And now I'm going to do just like I did along your back. I'm going to percuss across your abdomen. There's tympany noted throughout the abdomen. So now I'm going to palpate, noting any masses. And just let me know if there's any tenderness while I do all of this. Okay. Any tenderness?
No.
Okay. So now we're going to try and palpate your liver. So I'm going to try and raise you up a little bit, and I'm going to push up. And as I'm pushing up, I want you to just take a deep breath. Okay. Tail of the liver is noted. And then we're going to try to do the same with your spleen. Deep breath. Unable to palpate the spleen, which is normal. So now that I've done all that, I'm going to move towards inspecting your feet. So your capillary refill on your toes are good. Dorsalis pedis pulses are 2+ and equal. Posterior tibial pulses are 2+ and equal. So now I'm going to test the strength in your ankle. So if you'll push against my resistance and pull your nose or your toes towards your nose. All right, wiggle your toes for me. Good. Now I want you to flex your feet up towards you. All right, and then extend it back to relaxation, and I want you to rotate them. Good. So we're going to move to your knee. We're going to flex your knee. We're going to extend your knee. Can you try to hyperextend your knee? So try to push it back. All right, and then we're going to flex it again. Check your strength. So don't let me push towards you, and don't let me push down towards your foot. Good. We're going to do the same over here. We're going to flex your knee. Extend. Try to hyperextend your knee. So try pushing it down. So you want to try and bend your knee backwards, which we can't do. All right, so flex it again. Now don't let me push towards you, and don't let me push towards your feet. Good. So we're going to check the strength of your hips. So we are going to abduct away, so don't let me pull. Adduction, don't let me push. And then same on this side. Don't let me, there we go. Okay, so let's go ahead and sit up. Okay. So now I'm going to check your hands for capillary refill. Squeeze my fingers. Strength is equal. Radial pulses are 2+ and equal. So make a fist. Good. Flex them out. and then rotate your wrist. Good. So now we are going to test steratogenesis. So I'm going to place an object in your hand with your eyes closed, and I want you to tell me what it is.
Coin.
Okay. And we're going to test graphesthesia. So I'm going to trace a number in your hand. I want you to tell me what it is.
3.
Okay. So let's do cerebellar function testing. So I want you to place your palms face down your hand, your thighs, and I want you to alternate them back and forth in your hands gradually or your thighs gradually getting faster. Good. All right, we're gonna do the finger to nose test. So I want you to touch my finger, then your nose, and every time my finger moves, touch it, and then touch back to your nose. Good. Okay, so now with your eyes closed, I want you to extend your hands out like this, and I want you to alternate touching your nose with your index finger. Good. Okay, so now we're going to test ulnar sensation. So I'm going to use this tuning fork again, and I just want to make sure that you can feel this.
Yes.
Okay. And do the same over here.
Yes.
Okay. So let's test your strength and range of motion. So as far as your wrists go, I want you to put your wrist out, and I want you to hyperextend it up, bring it back to extension, flex it down. Good, and then do a rotation for me. And then let's test the strength in your elbows. So straighten your arms out towards me, flex them up towards you, and then try to hyperextend them out. All right, and then flex them back up. Don't let me pull, don't let me push. So as far as your shoulders go, I want you to flex them straight up in the air. Okay, bring them down for abduction, and bring them up to your side for abduction. External rotation behind your back, internal rotation up behind your neck, and then bring them out towards flexion, and I want you to do some circles. Good. So now we're going to do your deep tendon reflexes, okay? So I'm going to grab your arm, and I want you to just relax. Brachioradialis, brachial, triceps. Same on this side. Brachioradialis, brachial, triceps. Come down to the patellar, Achilles, and I'm going to test your Babinski reflex. I'm going to run this up the side of your foot, okay? Okay. Babinski reflex is normal. No toe flaring noted. All right, so now I'm going to get you to stand up. All right, and so at this point, I'm going to check your spine. So I want you to bend forward. I'm just going to run my hand down your spine. I'm not noting any curvature of the spine or bulging discs, so stand back up for me. And we are going to test the range of motion of your hips. So we've already seen you flex forward, so I want you to hyperextend backwards. Okay, back to extension. I want you to lateral flexions from side to side, and then I want you to lateral rotate from side to side. Good. Okay, so now I want you to do an external rotation of your hip, internal rotation of your hip. Good. Bring it back to external rotation and do a circumflexion. We're going to do the same thing on the other side. We are going to adduct with external rotation. We are going to adduct with internal rotation, and then we're going to external rotation and circumflex back out. Okay, so now we are going to do the Romberg test and do proprioception test. So I want you to just stand here, and I'm not noting any swaying or excessive movement, so close your eyes. I'm going to watch you do this again. Again, no swaying or excessive movement noted. So now what I want you to do is I want you to walk this way normally. Just walk to the wall over there normally. Good. Turn towards me. Now with your eyes closed, we're going to test your tandem gait, and I want you to walk with your heel to toe all the way back, kind of halfway between me and you. Good. Okay, so now the last thing that we need to do is I need you to hop on your right foot. and then hop on your left foot. Okay. So this concludes your head to toe assessment.